a look at one of the smallest heart pumps in the world that is being used right here in Arkansas to save lives.
Working for you in the spirit of Arkansas, this is Channel 7 News Nightside.
Well, it's one of the smallest heart pumps in the world, and it's being used right here in Little Rock. It is called the Impella, paving the way for extra time to heal and prep for a new heart.
Baptist Health was the first hospital here in Arkansas to implant the Impella in a patient. And to date, they've implanted around 20. Channel 7's Maureen Glisovic spoke with a patient who didn't know what this pump was until it was time for surgery. Maureen?
Well, Beth and Scott, Tony McNatt began having heart complications in 2002. Nearly 10 years later, the left side of his heart started to give out. And just when he was patiently awaiting for an artificial heart known as a HeartMate, he says he thought he was a goner until this cutting-edge technology kept him alive.
I've been doing good.
Have you?
Yeah, everything's going good, getting ready to get out of school for the summer.
Oh, really?
Meet Tony McNatt, one of nearly 20 patients at Baptist Health that's had an Impella implanted, a device performing life-sustaining functions.
Well, I did not know anything about the Impella until they were going to put it in me.
McNatt was being treated at Baptist Health in January 2011, awaiting an artificial heart, or the closest device to one, known as a HeartMate 2. He says it was while waiting when his heart began to crash.
They came in there and basically said, we've got to do this right now. And Dr. Ransom explained to me what he was going to do and what it was. And before I knew it, they were putting it in.
3 different Impellas are used at Baptist Health, but only one is surgically implanted, the Impella 5.0, made by Abiomed, an intravascular microaxial blood pump delivering up to 5 liters a minute of blood from the left ventricle to the aorta, equivalent to what a normal heart should function like. It was this Impella keeping McNatt alive until his HeartMate transplant.
Again, his kidneys and liver and things weren't working and well enough for us to do a significant operation and implant that. So we used the Impella and put it through his axillary artery and was able to support him very nicely with that until everything recovered and he got in good enough shape that we could take him to the operating room and implant the HeartMate 2.
This is one of the smallest heart pumps in the world, and it was Baptist Health here in Little Rock that was the first hospital in the entire state to implant one of these into their patients nearly 5 years ago.
And it spins this motor. As it spins, this Impella sucks blood in through these holes, and then it goes across the aortic valve, and blood comes out, ejects through these holes. So it spins fast enough that it can suck blood out of the heart and pump it at a very effective rate. This one up to 4.5 to 5 liters.
Just days after the Impella was implanted, Dr. Ransom and his team took the Impella out and successfully implanted McNatt's new HeartMate.
Once I got it and began to recover from the HeartMate surgery, I was realizing how much I could do compared to what I was before. And now I'm able to go to school and do most of the things, travel. I basically live nearly a normal life.
McNatt now walks around with 2 batteries strapped to his side and his lifeline resembling a fanny pack carrying his HeartMate. But without the Impella that kept him alive long enough for his new heart, he says he's sure he would not have been here today to share his story.
The Impella has allowed me to live. If it had not been for that, I would not have made it to surgery to get implanted with the HeartMate. It's that simple.
The Impella is still a fairly new device that's only been used by healthcare providers for less than a decade. Prior, doctors were forced to use bigger pumps that would render a patient almost immobile. The other 2 Impellas Baptist Health has is only used during surgeries and immediately taken out, while the 5.0 can be implanted for up to 30 days.